Hello, everyone. Bonjour, buenos dias, harada. My name is Marion Pitters, and I'm delighted to be facilitator for today's webinar. I'm here to introduce our expert speakers, moderate some questions from you, our audience participants, and ensure that the webinar's progress according to the schedule so that we respect everyone's time. But first, on behalf of McMaster University, it is my pleasure to welcome you to the 10th and final of the 10-part series, Expert Perspectives on Pandemics. Over the course of the series, we have had participants from all over Ontario, Canada, and the globe, graduate students, faculty from McMaster and partner institutions, as well as representatives from the Pan American Health Organization, PAHO, the World Health Organization, WHO, and members of our larger global health community. Many of you are contributing your skills to mitigation of the COVID-19 pandemic. We welcome you all to today's compelling session. The COVID-19 emergency presents a global challenge to our healthcare systems, our economy, and our ways of living. In the face of this unprecedented global health crisis, McMaster is dedicated to innovation and collaboration in the discovery of solutions to help combat COVID-19. This series is integral to the Master of Science in Global Health and reflects the transdisciplinary nature of global health. Experts have delved into topics including historical trends, vaccine development, the threat of antibiotic resistance, and Canada's research response to COVID-19. A quick overview of the 10 webinars in our series can be found at the link where you registered, globalhealth.mcmaster.ca/2020 webinar series. At that same link, you can access recordings of all 10 webinars. Today's session is Webinar 10, Lessons from History, Looking Back, Moving Forward. A final housekeeping note before we start. Time has been built in for questions and discussion at the end of the webinar. Please use the chat tool to submit questions electronically throughout the presentation. And note that while we may not be able to get to all of your questions, our speakers will aim to address them afterwards on the Global Health website. At this point, I would like to introduce our speakers. Dr. Andrea Baumann is Associate Vice President of Global Health, Faculty of Health Sciences, McMaster University, Director of the Master of Science in Global Health Program, and the Director of the World Health Organization, WHO, Collaborating Center in Primary Care and Health Human Resources. When she's not thinking about her work in global health, Andrea pursues her interests in opera. Andrea Boughn is an MSc candidate in the Global Health Program at McMaster University. Amelia graduated with a Bachelor of Arts from the University of British Columbia, majoring in history. Her recreational interests include playing and coaching hockey and practicing classical piano. And during quarantine, she's taken up long-distance running, rollerblading, and rereading Harry Potter. Dr. Baumann and Amelia, we look forward to your presentation on lessons from history, looking back, moving forward for the next 30 minutes. I'll provide you with a reminder at the 28-minute mark, and then we'll invite you to engage our global participants in a Q&A session for 15 minutes. Over to you now.
Thank you, Miriam. And again, welcome to the final lecture of our 10-part Expert Perspectives on Pandemics. We'd like to thank all of you who have been with us from the beginning and those of you who are joining us for the first time today. We planned the series to accomplish 4 objectives: to provide a broad array of topics demonstrating the complexity of the issue, to highlight the transdisciplinarity and thus the complexity, to pique your interest for further exploration or study into the topic, and finally, to provide you with exposure to information that has a scientific base. I encourage any of you who did not capture all of the series to go to our website and view our presentations. Today's discussion will focus primarily on the present and moving forward. In preparing this presentation, Amelia and I thought very long about our approach. We decided to focus on research as well as explore topics that are related to the pandemic that we were unable to cover in the series. The first slide please, presents some quotes from our expert speakers that reflect a variety of perspectives. I asked each one of them to provide us with thoughts or quotes reflecting on their presentation, and I would ask you just to read them and reflect upon them. Throughout the series, there have been questions that did not directly relate to the lecture at hand, but were nevertheless compelling. We thought, in looking at all these questions, why don't we explore two of these questions in depth? Because they contribute to the further understanding of the issue of pandemics. Thus, we are focusing again on the present. I would also like to thank those participants who submitted many questions. So the first question is, next slide please. Why are responses to pandemics often slow? This is an interesting query and one that we had over several times. In some ways it is counterintuitive, and the answer lies, not surprisingly, in many theoretical areas that include political science, public health theory, and cognitive psychology, just to name a few. It is in these disciplines that you see some science, some research that again begins to clarify why responses can be slow. The answer is on a global macro level, i.e. world leaders, micro level, individual citizens. Early in my career, I focused on rapid decision-making in crisis situations. I was intrigued by people or how people make decisions and what makes the decisions effective. My chief area of interest was emergency units and intensive care units and how clinicians, nurses, and doctors put together a complex array of symptoms, acted quickly, and often in life-threatening situations. This early research demonstrated how algorithms, such as cardiac arrest, increase both effectiveness and efficiency of decisions. There's quite a bit of work going on, again, with decision-making in AI, of which algorithms are an integral part in order to increase the efficiency of decisions. This is not always possible in a pandemic. In some ways, though, the understanding of how individuals make decisions is manifest in the emergency preparedness plans of various countries. So if a country, for example, invests heavily at the local level, such as a country like Japan, in training the public in how to deal with emergencies on a continuous basis, it will support an obvious, more effective response, i.e., it's a type of algorithm. You're doing it over and over again. I'll give you a salient example. A colleague of mine in Japan, Professor Yoshi Kojima, conducts seminars with school-age children. He's a university professor, and he spends his weekends, or some of his weekends, with children ages 1 to 9, dealing with emergency preparedness specifically related to earthquakes. He takes groups of children, approximately 30, and he walks them through the different steps that you carry out in an earthquake, including the shortest route from home to school and school to home. He goes through a variety of issues with them, and the children ask many questions, and this is done on an annual basis. So when, of course, an earthquake comes, the population is ready. However, it is evident in this present pandemic that world leaders have a different philosophy, different degrees of discomfort with uncertainty. Some do not recognize the need for proactive investment in disaster or emergency planning, and thus countries' response can be slow as a result. We recognize this isn't the only variable, but it's an important one. At the population level, people in general have difficulty with uncertainty. The cognitive psychologists have shown us that people use various mechanisms to decrease this uncertainty. Among the most common are issues such as bias. Next slide, please. There are many, many biases now. The work on bias has taken place over 30 years, and we're learning more and more how people think and how people deal with uncertainty. I just put 4 up on this slide to discuss. One of them is the bias of what they call normalcy. So the human adaptive model is to try to maintain a steady state, i.e. see things in the context of normal. Therefore, anything outside this parameter, people will work to pull it into the view of normalcy. It's closely related to the bias of optimism. Now, optimism is a very positive trait. However, taken to extreme, it can lead to issues of decision-making, which perhaps do not take into account issues of uncertainty. The other bias that's really important is recency. So people tend to remember what happened in the direct, immediate past, and they apply it to the present. Using those set of variables is not always appropriate. So the recency bias does not often take into account things that happened in history. It really deals with what happened to me in the past. So if I've been involved in an earthquake a week ago, a small earthquake, if there's a small trembling, yet again, I will immediately be responsive to the issue of earthquakes. If I've never been involved in an earthquake, the recency bias does not even come into play. And this is an example of pandemics. Our last pandemic was SARS, and I'll talk about that in a minute. The other bias, which is really interesting, and we see that in world leaders, we'll talk about that a little later, is overconfidence. This is especially true in doctors and nurses in our early studies in looking at decision making, because it's very important to look confident to clients that are coming into emergency or patients coming in. We have to always look like we know what we're doing, even when sometimes situations are maybe perhaps out of control. That bias really works, but again, it's like anything else, it does not work when it's in the extreme. Someone who's incredibly overconfident will never really be able to look backwards, i.e. to look at what they had done wrong, because their confidence levels are very high. So some of these biases are very helpful in daily life, but it's like anything taken to extreme, they can get in the way of decision making. In the next slide, there are 2 books germane to today's topic. Although there are many other books, and I do have an extensive bibliography on decision making, if anyone would like to have it, I would be more than happy to share it. The first book is especially timely. I got the citation from an excellent article Tim Harford wrote in the Financial Times in mid-April. He summarized some of the key issues and leading authors in the area of decision making, and his article did focus on why we fail to prepare for disasters. The ostrich paradox is a bold exploration of the disconnect between the reality and action. Meyer and Krenruther highlight the tendency of individuals, communities, and institutions often to underinvest in protection against low probability, high consequence events. They pinpoint the role of bias in undermining emergency preparedness. How often have we seen political leaders respond rather than act? As time moves on, urgency fades, i.e. the recency bias, and the focus shifts to the present with little regard for past or future. The tendency of politicians to be short-sighted is well documented. Effective measures and vigilance are not maintained once the proverbial dust of an emergency situation is settled. An example of that in Canada was, of course, the SARS epidemic. It was contained quickly, and we had a lot fewer people die in SARS. It's a different type of virus. But at that time, it was very emergent. What did we learn then? We learned that healthcare workers, if they went from hospital to hospital, working in more than one place, they became one of the transmission issues in the virus. From that SARS crisis in Canada, the government had two important commissions. They recognized the part-time, full-time, people working part-time to make a full-time living. They corrected it. So the nursing situation in Canada went from 30% full-time, although most of them working part-time status, working full-time hours, working in more than one place. The government then rectified that and encouraged institutions to hire people full-time, so they did not have to work part-time, full-time pay, and go from institution to institution. That exists today still, 70% full-time. But what they did was they casualized the non-professional workforce, personal support workers. Now they are working from institution to institution. We are not going to talk about the long-term care situation, but many of you have recognized the high mortality in our elderly population across many countries in the world, and part of it, the issue is the transmission from institution to institution. So that's an example, again, where a big crisis in 2003 took about 2 years for the history to fade and everyone to forget. The second book on the slide is a very famous colleague, Kahneman. His Thinking Fast and Thinking Slow research on decision-making and bias is a very good overview. He talks about two systems of thought. System 1 is fast, instinctive, and emotional. System 2 is slower, more thorough, and more logical. Both are evident in a pandemic response. However, as demonstrated by the presentations in the series, the multisectorality of the issue and the myriad of actors and agents involved add additional layers of complexity and confusion. And indeed, governments and people need to determine what is fact and what is fiction. Next slide, please. You all recognize this fellow. Throughout the series, there have been many questions regarding why don't people rely on evidence, and why are they swayed by information that is not based on fact or research. To answer these questions, Amelia and I thought we would spend some time exploring the factors that contribute to the phenomena. In the next part of the lecture, I would like to introduce Amelia. She is going to provide us with some insights into conspiracy theories. Why did we pick conspiracy theories? Because again, in the previous 9 lectures, we actually tried to focus on research and evidence. And we said to ourselves, well, there's other powerful forces going on, fact versus fiction. And we thought conspiracy theories are prominent in most societies, both historical and present. And we thought it would be worth our while to spend a little time on conspiracy theories. Why do the public see them as important? Why do they appear through history? And they certainly are probably never going to subside in the future. So Amelia, without further ado, can you take it over, please?
Thanks so much, Dr. Baumann. So conspiracy theories are really the antithesis of everything we've heard experts talk about so far in this lecture series. Speculative, grandiose, and often accusatory, they breed public mistrust in government, healthcare, or groups who are already marginalized. And contrary to what many of us would like to believe, conspiracy theorists are not just fringe, uneducated, and radical actors with no real influence or public reach. As we'll soon see, a wide swath of the population actually believes in one or many of these theories, including our elected officials. Pictured on this slide is Mike Pompeo, who recently has been criticized for spreading around the Wuhan lab conspiracy theory about the origins of COVID-19. Narratives such as these spread rapidly and can have an impact on the way populations respond to their governments in the midst of crises such as this one. My goal here is to provide some basic definitions and a historical overview of this phenomenon and its relationship to pandemics. The information I'll be presenting is the work of other scholars, which I've collected through a review of the literature on conspiracy theories and societal crises. So what are conspiracy theories? Well, Karen Douglas defines them as attempts to explain the ultimate causes of significant social and political events and circumstances with claims of secret plots by two or more powerful actors. This is just one of many definitions out there about a conspiracy theories, but through all these definitions run the common thread of the conspiracy theory as a narrative about a maleficent actor plotting significant social or political events, often as a means of consolidating their own wealth or power. People have been theorizing about secret conspiracies since antiquity. The historian Tacitus, writing in the 1st century AD, hypothesized about how the Emperor Nero had conspired to start the Great Fire of Rome in 54 AD as a means of clearing out the city so that he could rebuild it to better suit him without having to seek approval of the Senate. However, the term conspiracy theory, as we think of it today, with its connotations of paranoia and fringe thinking, didn't emerge until the 1960s United States, when it began to be used to describe those conspiracy theorists doubting the validity of the Warren Commission, an investigation which confirmed that President John F. Kennedy's assassination was not, as many people believed, the result of a greater conspiracy. At that time, American historian Richard Hofstadter wrote a piece called The Paranoid Style in American Politics, which examined the roots of conspiracy theory in the United States as a political pathology. Today, Kennedy's death is a source of some of the most persistent and popular conspiracy theories in the world. One of the reasons conspiracy theories persist is because it's incredibly difficult to separate conspiracy theories from actual conspiracies, of which there are many scattered throughout our history. However, while conspiracies are acts, conspiracy theories are merely perceptions. Conspiratorial thinking is a mode of thinking which is actually quite different from academic historical inquiry that uncovers real conspiracies. The 7 traits of conspiratorial thinking, seen on this slide, are useful in distinguishing the two ways of thinking. Most notable of these traits is the immune to evidence trait. Because conspiracy theorists predict evil and secret goings-on, often at the highest levels of government or organization, any evidence that counters or disproves a theory can actually be reinterpreted by theorists as further evidence of conspiracy at the highest levels, by just claiming that those in power merely planted the evidence in question to further hide the conspiracy. In this way, conspiracy theories can never actually be disproven. So what shape do conspiracy theories take? What are they about? The typology on this slide is a synthesis of the work of 2 scholars, Brotherton and Goulias, who used surveys and historiographies to group theories into several main categories. The first type, malevolent global conspiracy theories, refers to theories about secret organizations and societies, such as the Illuminati or the Freemasons, plotting to take over the world. The next 3 types of theories, UFO, mind control, and Nazi theories, are quite self-explanatory. The 5th theory listed here, New World Order theories, gained popularity after the Cold War. These geopolitical theories predict plots among rival or foreign governments to spread their respective ideologies and gain economic dominancy on a global scale. And finally, theories of hidden or bad science refer to theories which claim that governments and medical institutions are conspiring to withhold factual or share fraudulent information with the public. Most theories don't fit neatly into one category, but will actually merge into two or three. The image on the right shows data taken from the Chapman University Survey of American Fears in 2016, which asked respondents if they believed that the government was withholding information about certain events. The conspiracy theories associated with most of these events fit into one or several aspects of this typology framework, and we can see from the results of the survey that beliefs in concealment and conspiracy on the part of the government are actually quite common among Americans. On this slide, we see just a selection of many conspiracy theories used as pop culture content. So that brings us to the question of why conspiracy theories are popular. Why do so many people believe in them? Scholars from various disciplines, from sociology to philosophy to evolutionary biology and psychology, have grappled with this question. Today, I'm just going to touch on a field of psychology. Psychologists attribute our tendency to believe conspiracy theories to three main motives inherent in human thinking: epistemic, existential, and social motives. Epistemic motives refer to our desire to find answers and attribute causes to events. This motive grows stronger the more significant an event. During an event as significant as a global pandemic, where life as we know it has been disrupted and information seems to be changing and evolving almost every day, conspiracy theories may provide a means of making sense of the world and finding a simple cause for an incredibly complex global event. One study on this topic found that people were more likely to attribute a conspiracy theory to an assassination if that assassination ended up causing a war. Therefore, more destructive events are associated with higher belief in conspiracy theories related to the event in question. The second human motive is existential, which refers to our inherent desire to feel safe and in control of our own environment. Psychology research has shown that people who are anxious, feel powerless, or lack socio-political control are more likely to believe in conspiracy theories, which by nature undermine those in power. During a pandemic, people lose most control of their lives. Whereas we used to live our lives with relatively little government interference, today we can't even go to the park without getting a ticket for loitering. It's reasonable then to see how times such as these would decrease people's sense of autonomy and send them searching for a way to regain it. And finally, social motives can also explain why people believe conspiracy theories. Social motives include an individual's desire to belong to a group and to maintain a positive image of this group and of oneself. Research suggests that members of in-groups stigmatized due to race, ethnicity, or income are more likely to believe in conspiracy theories, as are people on the losing side of political processes and people who have previously experienced ostracism. Psychologists predict that by believing in conspiracy theories, individuals and groups are able to valorize or uplift themselves at the expense of the outgroups which conspiracy theories target. What theories you might believe in depends on which group you're a part of. A study led by Joseph Skinski supports these conclusions. In this study, researchers analyzed 100,000 published letters to the editors of the New York Times and the Chicago Tribune between 1897 and 2010. They found that conspiracy talk in letters to the editors spiked during times of war and times of election. Additionally, if a Democrat president had won the election, letters containing conspiracy theories about the left and communists increased, and vice versa if a Republican president had won the election, supporting the idea that in times of unwanted chaos or change, individuals look to conspiracy theories about other groups to valorize their own groups and identities. During times of crisis like the one we're in right now, people are isolated from their friends and family, and many people are experiencing unemployment and job insecurity. Conspiracy theories may provide a source of community connection and an opportunity to attribute the situation to someone or something concrete. And so that brings us to the relationship between conspiracy theories and pandemics. Over the past century, we've actually seen this psychological phenomenon play out during pandemics and epidemics. During these times, two types of conspiracy theories really seem to dominate: the New World Order theories and the hidden bad science theories. This slide illustrates some examples of how these types of theories have come to fruition during the pandemics and epidemics of the past century. It's just one way of organizing some of the trends that I've noticed while reviewing literature on the topic. New World Order theories often manifest as something called disease origin stories. So at this point, we're probably all quite familiar with these. These are the stories that accuse specific governments of manufacturing viruses in labs in order to weaken the rest of the world and make it easier for them to consolidate wealth and power on a global scale. During the Spanish influenza, a newspaper in Rio de Janeiro, Brazil, reported that the German government had manufactured the influenza virus in a lab and spread it around the world as a weapon of war using submarines. The comic you see here in the top left, showing a German submarine officer depicted as a skeleton, was published in this Brazilian newspaper in the midst of anxieties surrounding not only the pandemic, but World War I as well. The image below that shows a cutout from a Communist Party newspaper published in New York City during the Cold War in the 1980s. The headline reads, "AIDS is germ warfare by the US government against gays and blacks." The theory described here doesn't target a rival government necessarily, but a rival political ideology. This particular theory emerged in the midst of an ideological war between proponents of communism and democracy. But a similar origin narrative was also spreading among the African American community at the time. This was a group of people who had concrete historical reasons for their lack of trust in the US government and the medical establishment. Most notably, the infamous Tuskegee syphilis experiment, a real conspiracy in which researchers knowingly and secretly withheld the new and novel antibiotic penicillin from hundreds of African American men participating in a syphilis study, many of whom eventually died. In the other circle, theories about hidden or bad science also flourish. Prominent here are the AIDS denialism theories. President Thabo Mbeki of South Africa believed that the HIV virus did not cause AIDS. One theory predicted that this connection between the two diseases was in fact made up by US pharmaceutical companies to reap a profit from antiretroviral medication. This theorizing, which prevented thousands from accessing treatment for HIV in South Africa, emerged in the midst of frustrations about drug patents and incredibly high drug pricing, and in a country still reeling from the horrors of white supremacist leadership and the apartheid regime. This cartoon depicts one of the expert panels Mbeki hosted, made up of leading AIDS denialist scholars from around the world. Similar theories came to fruition during the H1N1 pandemic in 2009, when thousands opted out of the H1N1 vaccine because of belief in conspiracies about made-up viruses, pharmaceutical companies, and profit reaping. And many theories don't fit neatly into just one category. A recent example are the 5G COVID conspiracy theories, which combine both theories about the virus's origin and theories about the hidden harms of 5G technology. The photo here is one of the several 5G towers burned and vandalized in the UK in recent months. Evidence of mounting fear and suspicion among many whose lives have been disrupted by COVID, but also disrupted by massive tech innovations, which have taken place over the past decade. In all of these examples, the content of the conspiracy theory means little without an accompanying analysis of the context surrounding its creation and spread. While it's important to not put merit into the content of conspiracy theories, especially those that target racial, religious, or other cultural groups, examining the complex conditions surrounding the origin and spread of a conspiracy theory may provide insight into or allow for a more nuanced understanding of systemic issues which surround the rapid spread of misinformation and conspiracy today. Conspiracy theories are just one of many types of fiction or misinformation that can spread rapidly via social media. For example, the current US administration proposes something called alternative facts. Even now, we are seeing the consequences of what the World Health Organization has called an epidemic of misinformation. This graph shows the results of a study by the researcher Kate Starboard, who analyzed the life cycle of a single tweet containing inaccurate scientific information. The purple circles, orange diamonds, and green circles represent retweets, quotes, and retweets of quotes. And we can see from this graph the exponential impact that even one retweet of a misleading piece of information can have on its reach. The more conspiracy and fiction that circulates, the harder it becomes for people to access verified information and to separate fact from fiction. We also see the consequences of the spread of conspiracy theories in protests, which have sprung up around Canada and the US. Though the messages of the protesters is an issue, as they often further spread sentiments of distrust and belief in conspiracy theories, it's not the protests themselves that pose the greatest threat, but the health consequences that will result from thousands of people gathering close together, free of protective equipment, in areas where community spread of the virus is still rampant. And finally, a consequence which we have not had to tackle yet, but will have to in the future, is vaccine hesitancy with regards to the COVID-19 vaccine. Vaccine hesitancy is a manifestation of mistrust in the healthcare system, among other things. When we finally do have a vaccine for COVID, it will prove integral that as many people as possible get vaccinated. Thus, conspiracy theories about pharmaceutical companies and the virus as a made-up phenomenon may amplify existing anti-vaccine sentiments in the population and pose issues down the line. Many leaders are already predicting that things will not return to normal without widespread vaccination, yet even with a vaccine, widespread vaccination might not be possible if anti-vaccination sentiment spreads. Along with investments in vaccine development, governments need to anticipate the spread of conspiracy theories contributing to vaccine hesitancy and invest in public perception campaigns. Planning ahead and anticipating the spread of these theories before they arise will prove crucial for governments and for the WHO during the remainder of this pandemic and during outbreaks of the future. And now I'm going to pass it back to Dr. Baumann, who will provide some concluding remarks.
Excuse me, Andrea and Amelia. It's just a couple of minutes left in your presentation. Thank you.
Thank you, Miriam, and thank you, Amelia. That certainly provided us with good overview for further examination, the issue between fact versus fiction. In concluding our lecture, Amelia and I would like to present a slide that in some way emphasizes how we began. Next slide, please. During our initial brainstorming sessions, we talked about what world leaders do what they do and how they act like the way they act. In the days ahead, may or may not be perceived as handling the pandemic effectively. In her lecture, Sonia Delat noted how a photograph or slide could have tremendous meaning. We think this slide proves her point and provides the basis for a more fulsome discussion of leadership during a pandemic in future days to come. Moving forward, we would like to keep the momentum of the inquiry going. The next slide presents, next slide please, some of the questions that have arisen during the 10-part series. One of the dilemmas in global health is also one of the greatest strengths, the need to look at an issue from a variety of perspectives. It was the goal of this series to provide a more nuanced view and to highlight complexities. Next slide, please. We know some countries are ahead in the pandemic, recognizing history, marginalizing misinformation, and debunking false claims. That's not true of every country. So what are our next steps? I'd like to show the next slide. We'll be sending you all a 2-question evaluation to find out the following. What are the topics you would like to see covered in our future webinars? Would you like to be involved in future webinars? And those will come out to all participants that have been with us in the series. So I will conclude to thank everyone for attending. Please continue, as I said, to send us questions in order that will help us organize our next webinar series. And thank you very much, and I'll conclude with a quote from an author and philosopher, Chris Jamie, who has said, "In the age of technology, there's a constant access to a vast amount of information. The basket overflows, people become overwhelmed. The eye of the storm is not so much what goes on in the world, it's the confusion of how to think, feel, digest, and react to what's going on." I hope this series has provided some clarity, and we look forward to your questions. Thank you.
Thank you, Andrea and Amelia, for a fascinating presentation on two questions. Why are responses often slow in pandemics? And what are conspiracy theories about during a pandemic? Very, very helpful. I would encourage everyone to submit your questions in the chat section. And I have one question for you. It's actually from me. You mentioned about why our response is often slow in pandemics. And there's much conspiracy theorizing about that question in itself, that people are hiding information, our systems don't work, we can't get the information we need in order to figure out what's going on in the pandemic. So as soon as there's any slowing down, because we're so used to instant access to information, people build conspiracy theories around that. And I wondered if either of you or both of you could talk about the whole idea of people conspiracizing, if there is such a word, about the slowness of information or responses that we experienced during this particular pandemic. Would either of you like to take that on?
I can start, Miriam, and then Amelia can follow, because both she and I have discussed this issue. There is an issue in crisis. People feel uncertain, very uncertain, and there's different levels of anxiety. This and information appears day by day. Often factual information appears. However, it's a fact on Tuesday, but might not be a fact on Thursday, because information is also informing, again, researchers, clinicians, as we're undergoing these pandemics, because there is a level of uncertainty. By definition, it's a crisis. It's not everything is certain. So what happens then is people who may have trusted to begin with, they become more mistrustful because they become more worried. They're not getting the information they need. They want to have, for example, masks is a good example. Evidence on masks, scientific evidence, is mixed. But masks also provide other things that are psychological. So regardless of the mixed evidence on the efficacy of masks, wearing a mask might increase a person's confidence. They can actually do something. We will know more once the pandemic's over, because the worldwide response and research has been huge. But also what happens again, and this is what Amelia was focusing on, is the rise of the conspiracy. Amelia, do you want to comment in the context of the question?
Sure, and I'm going to turn my camera on here for this Q&A.
Thanks, Amelia.
Yeah, just to build off Dr. Baumann's points, I think conspiracy theories can provide an attractive alternative to information from governments and public health authorities, which is often comes out maybe a bit slower and is more dynamic and changing, because conspiracy theories provide the answer. Even if there is no answer, or even if we don't know the answer yet, they fill in the gaps between what is known to create something that is easy and simple, I guess. So I think that's why maybe people turn to them, because when information from the government is always developing and changing based on current research, conspiracy theories just provide almost like a yes or a no, like this is how it is. And I think for people that can be more stable and attractive, but it also fills in a lot of gaps, and that's where the misinformation component comes in.
Okay, thank you for that. Anything else to add there, Andrea?
There's one other thing I think that, again, cognitive psychology, experimental psychology has really informed us a lot about beliefs and values. And one of the things that it has told us is that, or the researchers have told us over the years, is that once a person believes something, it is often very difficult to get them to change their mind. And again, so once they absorb the explanation, and it could be a conspiracy theory, it's very difficult to disavow them. It takes time to disavow them. And again, governments who are trying to change public perspectives, let's take tobacco. Tobacco is bad. They spent years trying to get the public to realize how dangerous tobacco was for individual health. They finally succeeded, but it doesn't happen overnight. So that's partly the issue of fact versus fiction. If you have a conspiracy theory in your mind and it has been effective for you for actually over a long period of time, it will take a little bit of time for you to change your mind. And that's where might be the answer of where we'll see resistance.
Okay, I'm gonna push that one a little bit further because it's one I asked Henrik as well. You're sitting in a group of people and somebody says something that you know is absolutely not true. What is a way that either of you might consider responding other than saying that's absolute hogwash and then they don't open up to your perspective? What are some words that people can use, because we're all privileged here, highly educated people that are attending? What can we say to people when we hear someone spout a conspiracy theory, or when we hear people just spouting something they've heard from a friend who's highly regarded, whatever? What are some words that the two of you would suggest that we use coming out of our privilege of knowing what the science says? What is it that we can do to help people take a second look at conspiracy theories in a social setting?
I think that's the challenge of researchers worldwide. If you take a look at the work that Dr. Jerry Wright does on the antibiotic resistance, he has a group of global experts in the issue of antibiotics and also the experts in One Health. They have known for a long time that, for example, you shouldn't be giving antibiotics to animals, right, because of antibiotic resistance. And people ingest antibiotics. And it just takes a long time to have a public swell of resistance, and this is resistance against giving antibiotics to animals. So Dr. Wright, in some of his lectures, he will try to address that. They obviously have the science behind it. They know that we should not have antibiotics in our water, etc., and so forth. So I think actually in looking back and looking forward, we have to look at exemplars or examples of effective communication that has changed public perception. Canada's role in tobacco control or tobacco changing people's values and attitudes around is probably a really good example. You have to simplify the communication. You have to say it over and over again. You have to use a multiple of mechanisms. And it has to be at a large level if you're going to change public perspective. And you cannot give up, because I think it can take an awfully long time, much longer than we would think, to change public perceptions with actual research. Amelia, do you have some thoughts on that as well?
Yeah, I think that you pretty much covered it. I can try to add a little bit, maybe more on a more micro scale. So I guess one of the reasons people, or that I've come across in my research, is people believe conspiracy theories to gain control and to improve self-perception, because often maybe people have been ostracized or made to feel inferior in the past. So I think that on a micro scale, empathy is also important. And without validating a conspiracy theory, I think it could be really important to just listen to and acknowledge a person and what they're saying, because to just speak down to them or, speak in a condescending way is probably just going to confirm and harden their beliefs. So I'm not an expert on this topic in any sense, but I do think from what I've read that empathy and listening to an extent can also be valuable on a micro level.
Okay, thanks so much, Amelia and Andrea. Here's a related question that's coming in. It's about how do we, through communication, how do we limit the extent of risky behaviors like mass gatherings? And that's probably something that, as the government lifts some of the previous recommendations around people being together in larger groups, what is it that we can do? And Andrea, you mentioned, simplify the message, get the message out through multiple mechanisms. In addition to those particular tips, are there any other things that you'd recommend about educating the public to limit the spread of conspiracy theories and to limit the risky behaviors that some parties are anticipating will come forward now that some of the regulations or recommendations are being lifted?
Well, this is where global information is very effective, because only in the last 4 or 5 days, countries have made a decision. Let's take Korea, let's take, Sweden had a different type of decision, and England. So these countries are opening up. They're allowing limited / somewhat unlimited exposure to each other, let's say. They're opening their schools. As they open their schools, we're now beginning to see research coming through about infected children. Now, mind you, the numbers are small. USA, there's different states, governors try to close their states, other forces keep them open. So this is actually the top topic, I would say, of this week, when to open. And you see our premier in our province on television every night dealing with that information as it comes in. There's actually no magic bullet or no right answer to this. We will probably know a better answer once the pandemic is over. Many would say, well, that's not very helpful. But information is coming in about rates of transmission, issues of those with subclinical signs, issues of importance of testing. So as the pandemic goes on, we learn more and more what becomes important. What was important at the beginning is not as important in the middle or the end. So it is a true sort of decision-making dilemma. Right now, top of mind is when to open, the issue of mass gatherings. There are mass gatherings in the world as countries begin to open, and now we're seeing information appear about possible issues with the perspective of allowing people to mingle in restaurants, on streets. I would say the evidence is not in, but it is becoming apparent what some of the issues in opening are. And in the next 2 weeks, we'll probably have a better formula about how large crowds, or if there even should be any. Amelia, would you like to also take an opportunity to
Covered
answer
it all.
Yeah.
I think you got it all. That was a great response.
Okay, thank you both for that. Another question that's coming in is, I guess this one is going to invite you to put on a different hat, maybe your ethics hat. So if you could both become Lisa Schwartz, our previous speaker, that would help us. I recently read that YouTube is screening out misinformation about COVID-19 in videos and increasing the presence of videos produced by the WHO and other reliable sources. Do you think this is a good approach, or will it contribute to more conspiracy theories against companies like YouTube who choose to silence false information? So let me read that again because it's a long one. I recently read that YouTube is screening out misinformation about COVID-19 in videos and increasing the presence of videos produced by WHO and other reliable sources. Do you think that this is a good approach, or will it contribute to more conspiracy theories against companies like YouTube who choose to silence false information?
Well, this goes right to the inherent issue of trust. So we all know we've come through a decade of lack of trust in formal institutions. And as Amelia pointed out, to a certain extent, the conspiracy theories arise when we're in a state of mistrust. If we have to trust certain organizations, so we have to trust organizations like the World Health Organization in order to filter out and prepare information that has accuracy in its very foundation. And so trust is a mechanism. If societies have transparency and they trust their elected, or in some cases non-elected, I guess, in some countries, officials, it's not a bad idea to emphasize information coming out of the WHO, one of the few organizations on a global level that has its focus on health. And that would be my answer. We have to trust organizations like the World Health Organization, like the International Migration Organization, like the International Labor Organization, worldwide organizations whose very mandate has been to produce information and to address issues of social inequity and overall health of the world. Amelia, would you have some comments on that?
Yeah, I completely agree. And I guess just to pick out one thing that Marian mentioned at the very end was if that type of censorship maybe would breed conspiracy theory among some people. I think that's a possibility, but I also think that, and this is speculation on my part, but I think that portion of people would be quite small compared to the benefits of preventing misinformation from spreading and, you know, reaching many people via YouTube or Twitter, such as like the tweet that I showed and that was in my presentation. So yeah, that's just a slight add-on.
Thanks so much, Amelia.
Yeah, one issue I would just add on that. One thing in global health, in terms of the very foundation of education in global health, and actually in many programs, in many university programs, the emphasis is look to more than one source. Even if you, I mean, one source is not, it does provide important information, but it's also important to look at a variety of sources and compare these sources, because even one YouTube is not going to tell you everything you need anyway. And sometimes in that exploration, you discover for yourself what you think is reality.
Well, thanks, Andrea, for taking it back to that individual responsibility of checking more than one source. Very helpful. I want to sneak in one last question. I know we're getting to the last, but just very quickly. It seems that many countries struggling with outbreaks of misinformation are led by populist leaders. Is there a connection between conspiracy theorism and populism? So let me read that again. It seems that many countries are struggling with outbreaks of misinformation, and they're led by populist leaders. Is there a connection between conspiracy theorism and populism? And I'd ask you to answer that one very quickly.
Amelia?
Sure, I will try to answer that very quickly. So there are common components to the two. Both consider appear people or the people in sort of a war against the elites who are more corrupt. And so those common components have led to some hypothesizing about associations between populism and conspiracy theories. And this has been backed up by surveys that show people who have populist beliefs or tendencies are also more likely to believe in conspiracy theories. I think one thing to keep in mind is that populists can be on the left or the right of the political spectrum. And though right now we're seeing right-wing populism is very visible, conspiracy theorists are not inherently right-wing. People who have extreme political beliefs on either side have a higher tendency of believing conspiracy theory.
Well, thanks so much, Amelia. I want to thank everybody for those fascinating questions, and we hope the exchange was helpful in understanding pandemics and ideas about communication. A special thanks to our speakers, Dr. Baumann and Amelia Boughn, for your excellent presentations and the insights you provided in the Q&A with our global audience. We really appreciate your contribution to this webinar series, and particularly this last webinar. Thank you so much. And now let's quickly wrap up. Thank you for attending today's session, the last of the 10 webinars in this groundbreaking series. If you missed any of these exciting webinars, you can access them at the website globalhealth.mcmaster.ca/2020 webinar series. We hope the series has provided you with food for thought for your continued learning and research in global health. Stay tuned for more online talks brought to you by McMaster University's Global Health Office. Enjoy the rest of your day, everyone. Thank you. Merci. Gracias. And dankjewel.